For this week's Case of the Week, I actually thought I would use one of my own cases, and I just grabbed one because I just wanted you to see this product if you haven't seen it before, because it kind of represents a different way to do something we've been doing for a long time. This is an adult patient who recently finished ortho. The result is not perfect with the anterior open bite, but she grew tired of having the braces on. I think is happy where she is now. Anyway, had the retainer, a typical Hawley with a metal wire going across the front of those anterior teeth, and didn't like how that looked and asked if we could do anything else. So here at the lab, this is a product called Clear Lock, and you can see that it's what I used to call like an Esthetic retainer, for example. It's a couple thermoformed hard splints that sit down over the teeth and keep them from moving. It's similar to what the Invisalign system uses as a permanent retainer at the end of treatment, and we make these here at Glidewell. And so there's nothing super unique about these types of retainers in and of themselves. It's more interesting how they're actually made, and it's another one of the products here at the lab that has become a CAD/CAM product. And so let me show you how we typically make these restorations, because it does tell an interesting CAD/CAM story. And so when you take an impression and send it in, we take the original stone model that you see here and we pour it up. So we receive hopefully a polyvinyl siloxane impression from you, especially if it's being sent from the East Coast, really anywhere being sent overnight. We're going to have better luck with polyvinyl or an alginate substitute than we would with a regular alginate. And when we get the impression, we pour it up, and then we take the stone model and we scan it. And so once we scan the model, we actually keep that scan in our system, in our cloud, and we keep it for you indefinitely. And then what we do is, using a 3D printer, we digitally print a duplicate model that's the same as the stone model here. And then we're going to go ahead and block out any undercuts as you see here, and then we're going to thermoform right on top of that. And then we go ahead and cut that out, and you can see how we take into consideration the gingival margins as we take that burr around on that printed model. And you might ask, well, why would you go to all the trouble of pouring a stone model and scanning it and then printing another model? And the reason we do that is because we can keep this, as you saw, it gets damaged at the end, but we have this scan in our system indefinitely. So if you have a patient that you've done Clear Lock retainers for, and they happen to lose their retainers, and we do these in multiple sets, by the way, so when we do the thermoforming, you actually have your choice. If you do a single arch like this, we'll send you 3 of these, and if you do an upper and lower, we'll send you 3 of the uppers and 3 of the lowers as well, which is nice because we can produce them quickly. And so the patient actually has a couple different sets of these, so if they happen to lose one, they always have a backup. But let's say they lose all 3 of them. All you have to do, the patient gives you a phone call, you give us a phone call, and we simply print another one of these models because we have the patient's original model that we scanned into the system, and we keep that for you for life. And so anytime you need a new appliance, a new Clear Lock appliance, we can make one for you. In fact, since we're able to print this model, we could actually make an occlusal guard for you if you wanted to have an occlusal guard made on this. So the neat thing about the Clear Lock is, because this is our CAD/CAM product in the thermoforming department, once we've scanned these models and we have them, anytime you want an appliance, we can print one of these models and make an appliance for you and send it back, and then the patient can just come pick it up. Now, hopefully they're still wearing their Clear Locks, because obviously if they don't wear the Clear Locks and then they want some more 2 years later, well, the scanned model that we have probably doesn't match what's in their mouth. But as long as they've been good about wearing the Clear Lock retainers, this model will continue to be accurate for any other appliance that you may want to have made. So this, again, is a very nice, high-quality model that came from a good impression. And if we look, sometimes I just grabbed a couple of models that we saw in the department. And unfortunately, we get models that are not probably as clean as they should be. I can see some distortion here on that central incisor. And as we look around, we can see some other kind of noise on the second molar and kind of on the first molar as well, too. You know, this was an alginate that was wrapped in a paper towel and was sent to us from Virginia. And by the time the baggie gets to us, even though the Ziploc is sealed and it was in a wet towel, the towel is completely dried out, and we don't know how much distortion there's been. You know, depending on the appliance, it still may fit or may not fit. But we really do like, if you don't want to use a full-price polyvinyl siloxane, you can use one of the Alginate substitutes, which are a cheap polyvinyl siloxane but much more dimensionally stable than an Alginate would be. And you can see here's another example on a lower model of just a lot of noise and voids and bubbles and things that were taken with the impression and then sent to us. And so when we scan this, we don't hold out a lot of hope for being able to make an accurate restoration, and we get the feeling that we probably don't need to scan this model in because it's not going to be accurate anyway. But when we see those nice clean models come into the laboratory, we scan them and we'll keep those on file for you and your patient indefinitely, so that if they need more clear lock retainers or any other appliance, we might be able to make it for them. And one last case from the thermoforming department. This is a doctor who just had our typical hard soft splint made. This is a hard outer splint with a soft inner layer. This is definitely our most popular occlusal guard that we make. But we had a dentist call me the other day and ask me, what about patients who want to wear it during the daytime? Is there something that's a little better than that? And we do have a daytime splint that I wanted to show you. And it's called the daytime splint. Let me raise that pin. And as you can see, it's a lower splint and makes it a lot less apparent than the one that's on the upper. And it also doesn't cover the lower anterior teeth, helping a little bit with phonetics. And so it provides support in the posterior, and it's not a full coverage splint, so it's a little easier to wear during the day. And of course, we would have the patient wear the full splint at night as soon as they leave work, so we don't get any super eruption of those teeth by having all of them covered and in contact. And so the day splint is also one of the Astron splints. And if you remember this material, we've talked about this before. This is the one that's thermally active. And so we can heat this up in a bowl of hot water, and then it'll literally twist into a pretzel if we want it to, and then it goes back to its original shape. So one of the nice things about the Astron material is if the patient, say, doesn't wear the daytime splint for a couple of months and then wants to start wearing it again because they're having some pain, you can heat it up in that hot bowl of water, just microwave it for 30 or 40 seconds, depending on your microwave. Put the Astron in for a minute or two, take it out and ensure it's not too hot, and then because of the fact it will now be flexible, get it down onto the patient's teeth and then have them bite into it again. And a lot of times I've been able to save splints where, had it been a full hard splint, I don't think there would have been any way I could have got it back down onto the patient's teeth. So that's one of the nice benefits of the Astron and the day splint.